Good evening, everybody. Welcome to the session of question and answers. So I'm trying to answer any questions that you have, as well as I've picked up some questions that have already been submitted to us. So I will try and answer them as well. One of the question was, what is a good skincare routine for a normal skin? So basic question. So if it's a normal skin, I understand that it is neither too oily nor too dry. So it's a general routine. Any skincare involves a few processes, a few steps. Basically, you'll have to cleanse the skin first. That is step one. So the cleansers are chosen based on your skin type. If it's a normal skin, you can use basically a cream-based cleanser, which is preferable, or you can also use a gel-based cleanser. But cream is definitely preferable for dry skin. So you can use a gel-based or a cream-based cleanser, but definitely normal skin, preferable not to use a foam-based cleanser, foamy cleanser, which is more aggressive and tries to reduce oil secretion or removes oil from your skin. Be careful when you use all these glow cleansers, whatever. You have different brands available. So anything that says glow, it will usually contain some alpha hydroxy acids. So you know acids will dry the skin. So if you use such cleansers, it's very important to make sure that you moisturize well so that the skin doesn't become dry, because a dry skin always tends to pigment more than a well hydrated skin. So the first step in any skincare routine is basically cleansing. Following cleansing, the next I'm sorry, there is some interruption because of the rain today. I'm sure it's raining at your place too. So bear with me if the connection goes on and off. And please post your questions and I'll be happy to answer. So the next step is that you scrub your skin well. So you can use, if you're at home, if it's a normal skin, just salt or sugar crystals is good enough to scrub your skin, or a home-based preparation with any, your grandma, mom would have prepared for you. It's good to use those scrubs. So just use a scrub at least 3 times a day. If it's a normal skin, you don't need to scrub them every day because you might make them remove all the oil. You're scrubbing to remove the remove dead cell accumulated on the skin surface. So it's like when you want to paint a wall, you obviously want to when we try to paint our home, we try first do scrubbing, right, with the sandpaper, and then they patch up all the dents, and then you paint. So similarly, when you want to flawless skin, you want to regularize the cell turnover, and so you're using a scrub. So first you cleanse and then you scrub. After that, a normal skin, you just want to maintain, you already have a good skin and you just want to maintain, just use a moisturizer and followed by a sunscreen. So today you have a lot of creams where you get a combination of moisturizer and sunscreen in one particular cream. So you don't need 2-3 creams. So just cleanse, scrub, and use a cream which contains moisturizer and sunscreen. That's it. That sunscreens, they come in different forms. And if you're using you're continuously working in front of a laptop, or you're constantly going out, or you're traveling in a bike, make sure you repeat the sunscreen every 2 to 3 hours if you're going to expose yourself with excess sun. Then again, when you get back home in the evening with all the dust, and if you've traveled outside with all the dirt, dust on your face, wash your face again with the same cleanser, and you can apply a night cream. And the night cream, if your skin is normal and you like the skin the way it is, and you just trying to maintain, just put only a plain moisturizer. But if you have a skin condition, you want some more brightness, you want some to protect from anti-aging, protect from aging, you want to tighten, then accordingly your physician will prescribe some night cream and you can use that night cream. So this is a regular skin routine. So the next question we'll move on to, what are the routine mistakes that people make with their skincare? So most of us get carried away by all the ads that we see. If you open Facebook, Instagram, anything, it's all advertisements. So you have hundreds of products that have been recommended. You have ads saying you have somebody's skin is so flawless, and they're saying, remember, they're all ads, right? So just because it's worked for a celebrity, it's very, very important. When you choose a skincare, just because somebody is endorsing and they say it's really good, application of the same cream in your face may not work the same, because your lifestyle, your how you eat, how you sleep, the time of your the duration of your sleep, the time at which you go to bed may all be different. Your weight will be different, your hormonal status will be different, and so the same cream which was really good and recommended by somebody may not work for you. So it's good to understand what your requirement is. And it's, yes, a lot of information, good information is also available in social media. So look at what is exactly your concern. Let's say someone has just hyperpigmentation, and you see hundreds of advertisements for pigment removal creams. Yes, when a cream is meant to remove pigment, it is advertised. But what type of pigment that you have? Is it very superficial? It is deep? Is it being induced by hormones? You may not, just a superficial cream may not be enough. It needs to be combined. The causative factor needs to be corrected. So the most common mistake is, don't go by what you see on the social media or what is recommended by someone. Understand what your concern is. I understand what are the ingredients that are meant for your concern. Look at the product that is recommended and see if those ingredients are present in the first 5. So because the dose will be very, very minuscule, it may not work for you. So first 3 to 5 ingredients are the major ingredients in any product. Look if those are going to help you, and then you may choose the product. But preferable to visit a physician. Ask them what is best for you. Once you get them, you understand what your concern is, you can do. But no harm. You can try what is available, what has been, so many things are available. You can try. But keep this in mind. Just because somebody recommended, just don't blindly use them. Next, someone wants to know what are the procedures for dark circles. So first, it's important that you understand what are the causes for dark circles. So periorbital pigmentation is what we call, or dark circle, is because it could be increased melanin deposit. It could be what we call hemosiderin, like you see people with varicose veins or venous problem. When they stand for a long time, I'm sure you have grandparents, elders at home, and when you look at their leg, it becomes over sometime, it becomes really dark because somebody must have told them that they have varicose veins or venous disorder. So what happens when the veins are full? The hemoglobin from the small tiny little vessels gets out of the blood vessel and deposits this iron in the subcutaneous tissue, and that causes actually pigmentation. That's what is called hemosiderin. So pigmentation because of melanin, pigmentation because of hemosiderin, then volume loss. Volume loss is continuous periocular movements can reduce the fat, or with your weight loss as well. With aging, there is a lot of periorbital fat, and the ligaments or the other structures which keep them in place becomes weak. So either there is, you see, under eye bags, some people call it. So you see the protruding fat pouches, or you see it is a hollow if the fat atrophies. Either one can happen. Next is a shadowing effect from the supraorbital margin. When the light falls, again a shadowing effect. So volume loss, shadowing effect, melanin pigmentation because of melanin deposition, pigmentation because of hemosiderin deposition, along with skin laxity. So all these could be, one of these or all of these could be a reason for your dark circle. So again, you see so many advertisements just doing one procedure. It's not going to help your dark circle. Your dark circle could be because of any one of these 5 things, or it could be a combination. So each of them needs to be addressed. There are some surgical options as well. We call them blepharoplasty. So in blepharoplasty or lower eyelid blepharoplasty or eyelid surgery, we remove the excess skin, where if there is a fat loss, we add fat grafting. If there is excess of the fat pouching because of lax ligament, we try to remove those pouched or prolapsed fat or redistribute them, and then the excess skin is removed. This actually gives you a permanent removal of your dark circle, and because again pigmented skin is also getting removed here, so that it solves that concerns as well. And the scar is very neatly hidden under your eyelashes and it's not seen at all. Of course, if you don't want surgery and if you're not a candidate for surgery, it is only when you have a lot of excess skin, and that excess skin is contributing to your dark circle. That's when blepharoplasty is recommended. So if that is not there, then you have many procedures. If it's predominantly the skin laxity which is contributing to the dark circle, then you can opt for skin tightening procedures. So skin tightening, one of the gold standard procedure is eye thermage, where a radio frequency wave is used to tighten your skin around the eyes. And it's not a replacement for blepharoplasty. So if you just do one session, it's not going to be the end of all the dark circles. And if it's only skin excess, it's going to tighten your skin, helps a little volume formation with collagen elastin. Sometimes a quick fix for dark circles could be just, if it's predominantly volume loss, a filler injection will replace that volume, and that can help you to improve your dark circles. But again, that will not completely remove your pigment issues. So for pigment, you have to use some creams. Again, when you use any creams, whether it's for your face or dark circles, anything, just like you have a huge range of creams for cosmetics, right? You have some Acne, some brand, and then you have other MAC and other brands. They're all of different range. Why they are of different ranges, different pricing? Because of the formulation. So the better the formulation, better the ingredients, or obviously your results are also going to be better. So for pigment correction, you will need some creams. Now, yes, we can do lasers. CO2 laser is used widely, but in a lighter skin, that is type 1 to 3, they could be used safely to resurface, to tighten the skin, to remove the wrinkles. But carbon dioxide laser is widely used. But in our skin, in type 4, type 5 predominantly, the South Indian skin, we have to be extremely cautious when we're using lasers, because that itself can cause other side effects. So be careful when you opt for a carbon dioxide laser or other laser for your dark circle. So the safe procedure to tighten the skin non-surgically is thermage. Minimally, you can do microneedling. If it's predominantly because of melanin deposition, some of these alpha hydroxy peels can help. But I'm not a great, I don't have preference to alpha hydroxy or glycolic multiple sessions around the eyes, because we are constantly exfoliating, you're making the skin thin, and if you don't build the skin, you're going to form more wrinkles. So in future, your maintenance becomes very high, and that may not be the right option. So I see a lot of patients who come to me after taking multiple sessions of peels for the around the eye, and so eventually your skin will become thin. So please keep that in mind, right? So for dark circles, the surgical option is blepharoplasty, lower eyelid blepharoplasty with fat grafting, and for non-surgical options include eye thermage, microneedling, and of course for pigment, 1 or 2 sessions of peels, and of course good quality creams. Yes, a quick fix solution, you have fillers, injectables, which can be applied, a little bit of Botox to reduce the wrinkles, and filler will give you instant improvement with your dark circles. Then the next question that I'm going to address is what is the best cosmetic procedure to slim down the face? So you have many procedures. I'm sure if you go and type these questions, Google will throw you hundreds of options. So when you want to slim your face or slim any area, so what you need to understand is what contributes to the chubby or big face or abdomen or any area. So you have to find out whether that chubbiness is contributed because of excess fat, or is it because of the weak muscles there not being very tight and that is contributing, or is it because of lax skin? So skin, fat, muscle, which exactly is contributing to whatever you're concerned, the face looking round or sagginess of the skin, and so on. So once you identify, then the treatment will be aimed at each of these, right? So skin tightening, you have the non-surgical option is to use therma, radio frequency skin tightening. So we all know radio frequency, either fractionated or non-fractionated radio frequency is one of the best form of energy to tighten your skin. And yes, ultrasound, I'm sure you all have heard about Altera, Alti, Algi, they're all brand names. So they all are used to tighten the skin, right? But this is for tightening. Thermage, because of the heating the subcutaneous tissue, fat, that is just like how you've heard of cool sculpting. Heating and extreme, the heating and cooling can also lyse some fat. So this fat is also lysed in terms of thermage. Yes, I've also read a lot of comments saying if you lyse the fat, then the skin tends to sag in future. But you should know how often to repeat and what is the energy that is to be given. If you're aiming along with fat lysis, what energy to be delivered. If you're only looking at skin tightening, what energy to be. So that comes with experience. So thermage is a good option to slim your face. The other option is today you also have injectables that can actually tighten, improve elasticity and tighten. So there is an injection called Profilo. So it's a hyaluronic acid. So what is basically hyaluronic acid? So when you will build a house or you build something, you put bricks and then there is cement to hold the bricks. Similarly, the cells on our skin, facial skin, they all are held together by what is called a ground matrix. And this ground substance, one of the predominant component is hyaluronic acid. With aging, with our lifestyle, this hyaluronic acid gets degenerated. And so when you replace that hyaluronic acid, it stimulates more collagen elastin formation and it tightens your skin. So yes, some injectables can be used to slim your face. So one of the common, you can use fractionated, non-fractionated radio frequency, ultrasound waves to tighten, slim your face. You can do injectables. Yes, there are surgical options where we can do liposuction, but you have to be careful. There are nerves in between the skin and the muscle layer or between them, and so extreme care needs to be done. Specialized instrumentation. Not all areas of face can be addressed with liposuction. The lower face, neck can be addressed with liposuction. And if you also have double chin, then they need to be addressed selectively. And then other common questions, right, regarding acne, what causes blackheads. And okay, so let's talk about the acne, right? So meanwhile, I'll quickly check if I am going to address, if I missed any questions in the process. Okay, no, I've not missed them. Yeah, so the next question is, why do someone gets blackheads? So in the skin, and there are also questions, right? Is there any overnight remedy for acne, and is acne treatment permanent? So I'll address all of these questions. So first, acne is an inflammation or overactivity resulting because of overactivity of your oil secreting glands in the skin. Now, can I have a permanent treatment of acne? It is possible only if somebody is able to remove all the oil secreting glands from your face, which is impossible, or that cannot happen. So yes, there is no permanent cure, but you can by good skincare maintenance, you can prevent acne from coming or erupting. So that's the key point. How do you maintain so why does this acne develop? So you have every hair follicles. So in this phase, some hair follicles grow and some are dormant, and these hair follicles, the oil secreting glands, which are called the sebaceous glands, open into the ducts of these through which these hair follicles come out of your skin. And these oil secreting glands, the sebaceous glands, secrete what is called sebum. And it is this sebum which comes out along with this hair outside that lubricates the outer surface of the skin and the hair. So it's an important function. Now what happens is, on the skin surface you have cells which are regularly, there is a turnover that's happening at the surface. And this sebum is regularly supposed to secrete a moderate or regulated amount of oil. When there is an accumulation of the dead cells and there is excess secretion of the skin, and what happens is they can all clog this duct through which this sebum has to come out. So once the duct is clogged, right, and if the skin is pore closes, then what you see, that reflection of that clogged over the overgrown skin under that, is called the whiteheads. Suppose that pore remains open, the melanin in this clog can get oxidized and appears from, when you look from outer skin surface, it appears black. So those are what is called blackheads. Now what is the best treatment for that? So if it is selective, some of the physicians will use a specific instrument called an extractor, where these pores are just opened with the nick of a needle and it extracted, because those clogs are called comedo, so it can be extracted. But my preferred option for I always say prevention is better than trying to solve after it inflames, because you don't know when exactly you're going to go to the physician. Now this particular clog, if it becomes because this oil secretion and normally there is a bacteria that is living on the skin, and when the pores get blocked, this bacteria, it's an anaerobe, which means when there is no oxygen, it will multiply. So then it starts multiplying. And in order to control that bacterial activity, the body's defense mechanism will act, and that is what causes those pustules. You see yellow, why does the acne become yellow color? It's because of this. Now it's become infected, you need to take antibiotics, and then you need to open up the pores and all this. So when you just have little comedones or a regular skincare, make sure that your cell turnover is uniform, as well as your oil secretion is under control. So oil secretion depends on your hormonal level, your sleep pattern, the amount of water you drink, your stress levels, whether you do exercise, your heating habits. It depends on all of these factors. So make sure that they are all healthy. So that is the only way you can keep the oil secretion or the oil secreting glands activity under control. When it is overactive, then we obviously prescribe medication to reduce the activity. Then along with that, we have to now regularize the cell turnover and also open up the pores. One of the best procedure for this is microdermabrasion, or now it is advanced a little more. The same microdermabrasion you do along with hydrating, because if you just keep abrading the skin, it can become dry, and so you're taking away all the oil, everything, so the skin becomes too dry. So what we do, Hydra Facial. So you do what is called Hydra Facial. So Hydra Facial is nothing but microdermabrasion done by a specific equipment, where during the process completely the skin is hydrated. So there are it involves steps in just like any facial, and so there is a first there is a cleansing, and there is a scrubbing, and pores are opened up, and this Hydra Facial, so it's called Hydra Facial MD. You all can look up on YouTube what is a system called Hydra Facial MD. When you use a microdermabrasion sort of a tip, it's actually disposable tip. For each patient, one tip is used, and we just microdermabrate the dead skin, open up the pores, and with all along with simultaneously hydrating the skin. And then we also use a peel. It's inbuilt with you have 7.5%, 15%, 35% mild glycolic peel, and that helps to brighten up the skin. And then along after this, you can add different types of serums, ingredients that can be infused into your skin to give brightness or improve skin elasticity, so on and so forth. And then we end it with a mask. So the best procedure to make sure that you don't end up getting blackheads, whiteheads is just like how you do facial. Instead of facial, you can do what is called Hydra Facial, or the microdermabrasion combined with moisturizing your skin. Right, so we'll move to another question now. I think Vel Murugan is still concerned. As I mentioned, Vel Murugan, thanks for your question. I will try to post your number or send me your number through our toll-free number. Talk to one of my representative, and I'll try to schedule an online consultation, and then we'll take it from there. Right. So the next question. So I've addressed all of this. So if you have a oily skin and you have you're breaking out on and off, make sure you meet a physician, follow a proper routine, and it's not enough if you just take some treatment for 3 months and then stop it, because you have a tendency, the threshold for activation of your sebaceous oily secreting gland is very high. So that's why it's an oily skin, right? So then you need to keep that under control. So you need proper skincare on a regular basis. It's not just for 2 months, 3 months, on a regular basis. So that is very, very important. So make sure you follow that. So so someone wants to know that there is a question who's posted to us with the skin. They have skin pigmentation, and what could be the reason for it? So the skin has 5 layers. You have melanocyte, which are the main pigment forming cells, which are in the basal layer or in the base of the 5 layers. And this 5 layers regularly undergoes turnover and exfoliation. So this melanocyte activity is controlled by hormones which are secreted in the body, and the hormonal activity is controlled by your lifestyle. So weight gain, your sleeping late at night, unhealthy diet, stress levels, all of this are, and if you have hypothyroidism, other hormone problems, periods are delayed, ovaries, you have having an ovulatory cycle, PCOD, all of this, right? They all at the end of it control the activity of the melanocytes. Once the melanocytes are hyperactive, they start producing pockets of melanosomes, and these melanosomes go and pack all the cells in the top 4 layers with pigment, and your skin gets pigmented, right? So when you are addressing hyperpigmentation, I'm sure many of us just go and do just peels. So you're just removing some layer. You keep removing this layer, melanocytes are active, and they'll keep producing melanosomes again and again, and you won't get rid of the pigmentation permanently. It's important that you take oral medication or good quality creams to reduce the activity of these melanocytes. That's very, very important. With the reduction of the melanocytes, gradual exfoliation of the tightly packed skin actually helps you to get rid of your pigment problem. So depending on whether it's very light, highly pigmented, or moderate, the creams given will change, but the basic principle is to reduce melanocyte activity. That's very, very important. So antioxidant intake and there are a lot of other antioxidants, other ingredients which will reduce your melanocyte activity, and you have to correct the cause. Like I told you, unless you correct the cause, you're not going to get a permanent remedy for a hyperpigmentation. Temporarily, all these creams will give you relief and it will come back again. So focus on correcting the cause. Also, you will be recommended with some creams, and of course reducing the activity. In type 4-5 skin, I am not in favor of regular continuous peels every time, every month, because you're constantly exfoliating and it will make your skin thin, and if you don't have proper aftercare, you're going to get repigmented, skin is going to become dry. So one of the suggestions is what we call controlled depth peel, or peels which are done little more aggressive but done less frequently, and will also reduce your pigmentation. And those, you have different brand names, Cosmilan, Dermamilan, all of this, I'm sure you've heard of it. Some of them give you better results. So and I have Velmurugan is again has some query, and he has hair fall and a sensitive pain in my scalp. Someone prescribed use of K-Shine shampoo and Folly serum. So you want to know whether it reduces scalp pain and thing. So K-Shine shampoo, it is basically given to reduce, it contains coal tar, ketoconazole. So ketoconazole is a antifungal, and it has coal tar, and it also has salicylic acid. So coal tar basically is read to reduce inflammation. Ketoconazole, salicylic acid will exfoliate, reduce inflammation. Ketoconazole for antifungal. Now a combination of this is given mainly for the so-called dandruff in your hair, and it should not be used every day. You should use them maybe twice a week, because too much of exfoliation and using them will make your scalp even more dry. And of course, Folly serum is a serum with peptides and multivitamins. Yes, you can use them, but whether it's going to help your hair fall and scalp pain, I am not able to give you a complete answer, because I don't know what's the cause for your scalp pain and hair fall. Whether the hair fall is because, see, now many of them come after a COVID infection, and the reason for hair fall is completely different. Because either some of them say they have clumps and clumps of hair fall, right? So that's maybe because of induced steroid, or it can be something what we call acute telogen effluvium, or a shock loss because of infection. But the treatment for that is different from someone who's got an androgenic alopecia, or alopecia means hair loss, androgenic means hormone-induced hair loss. So if it's because of hormone-induced hair loss, then the treatment is different. So you need to understand why you are having hair fall first of all, and the scalp pain maybe because when you lose a lot of hair and the scalp is visible, then whether your scalp is getting thinner and thinner by whatever your atrophy of the fat will produce pain. So we'll have to look at what is the reason and address them, and that will over a period of time will reduce your hair loss as well as control your pain. I hope that answers your question well, Murugan, and let me go to the next question. So is microneedling effective for improving skin texture, tone and color? So what are the procedures that are available for improving the skin texture? So you have resurfacing peels, you have lasers, you have microneedling, and you have fractionated radio frequency. These are some of the procedures that are available for resurfacing. That means smoothening your skin. Now, what is good for each skin will depend on what are we trying to address? Now, especially we are from Chennai. I am from Chennai. I'm not sure where all the viewers are from. So if we predominantly belong to type 4 and type 5 skin. So in type 4, type 5 skin, we tend to form pigment easily. Our skin is generally thicker compared to the Caucasian skin. So using lasers, we have to be extremely careful, because if you use less energy, you may not get great results. If you use too much of energy, you may get hyperpigmentation. So it's a very careful trade-off between the both. But as I mentioned before, controlled depth peels, not done too frequently, and following up with good maintenance cream. Yes, micro needling, but micro needling, you have a pen or you have a gun and you have needle or an equipment with needle, right? So basically that's only a technology. So you're using small micro needles which are just rubbed on your skin and it's exfoliating. But what gives you a better texture or a pigment correction is what is used along with microneedle. So that's going to vary from physician to physician what exactly they want to add. You can add growth factor serums, you can add glutathiones, antioxidants, you can add other brightening serums, you can add PRP, you can add anything. So it depends on what we are trying to achieve. So all of this can be used with the microneedling technology. So they all cause this nano pores or micro pores through which these serums go in and help to rejuvenate and resurface your skin. And so controlled depth peels, micro needling, and you can also do fractional radio frequency. So again, same fractional radio frequency, or is also going to cause those nano channels through which these serums are going to work. So what is applied after the procedure or along with the procedure becomes more important than the technique itself, right? So another question, do anti-aging creams actually work? Yes, they do work, but it cannot be the same anti-aging cream for everyone, right? When just about 20 and you just want to maintain your skin, it is and to prevent from aggressive aging, the requirement in the cream is different. But right, you just want to maintain a regular cell turnover, regular melanin pigmentation formation, and control of your oil. That's all you need. But whereas when we are 50 and we need to use anti-aging creams, we need creams that can stimulate collagen elastin formation, improve the wrinkle. So why does wrinkle form? Because all the facial muscles have attachment to the skin, and where these attachment is what is causing wrinkles. So improving all of that helps to improve the gives you the anti-aging effect. So when you're over 50, you might need more aggressive creams that has ingredients to work on improving elastin, collagen, reducing wrinkles by improving this with some more resurfacing effect. So a higher, more retinol based and aggressive creams may be needed. And as you all know, creams are of 3 types. So you have all the cosmetics that you buy, they are all have ingredients which are which does not change the cell structure and function. Then the next group is OTC products, over-the-counter products, which actually have ingredients which have to be FDA approved. So they are drugs, but they are OTC. You can just go to any skincare clinic or online and buy them. Then you have prescription range skincare, where so the same retinol, just in minuscule amount or a non-retinol, can be present in a normal cosmetic. With a lower range, it can be prescribed. You can buy it over the counter. But the higher range retinol, which may be required for anti-aging in an older skin, actually requires monitoring, because when you use too much of retinol, your skin can get burned. So you're trying to do anti-aging, and I see a lot of patients, they've been prescribed these small bottles of creams, whitening creams, anti-aging creams from the beauty parlor. There is no name written on it, and because somebody used it and they had beautiful skin, they just took those creams and they've started using. So they've been using for 6 months, 1 year, they had brightening, and so they continue to use. And after about 6 months or so, they felt that the skin was changing. It's becoming rough, and when they go on sunlight, it's becoming extremely red, and they feel that they can't expose the skin to sunlight at all. And at that stage is when they come to me. Most of these cream, believe me, they all have steroids, right? Your cream that you use on your skin, you need to know all the ingredients. You have every right to ask the person who's prescribing to make sure that we are not mixing products and giving you, right? Gone are the days where you have a pharmacy where you mix 2-3 ingredients, put it in a bottle and give it to you. Please be careful about the products that you use. That is why it's important you buy label products where there is some check on the ingredients that have been added to it. The first 3 to 5 ingredients are the most important. Don't forget about the 20, 30 ingredients that is added. The rest all minuscule. They may not contribute to the change in your structure and function. But the first 2 to 3 ingredients, very, very important. And that decides what is the primary role of that cream. So this is important. Don't use creams where there is no name, the ingredients are not mentioned, or it's just off the shelf, and then use it, because majority of them contain steroids. And then I recently had a patient who had some cream was given and she applied it on her skin because she had pigmentation around the groin. So somebody had prescribed to her some cream and she had applied. But what she came to me was she had extreme skin atrophy, that is very deep stretch marks. That skin was like a paper, that is about 1 inch skin in the groin on both sides was like a paper, red color. So you have normal skin above, normal skin below, but one where she applied the cream because she had pigmentation there. So she just gone somewhere, somebody gave her a cream and she applied. Very clear indication that it is called striae rubra, and it's atrophy, skin atrophy, and that is because it can only happen with steroids. So someone has given us some so-called pigment lightening cream without any names, and she's just been applying it for over 2 months, and she ended up. Now she came to me and she wanted to know, can I just excise that skin and close? So even if I excise and close, even that scar can widen. So she's not left with much options today, right? It's going to take a long time for us to get even 40-50% improvement. So be careful what creams that you use. Please do not use just off-the-shelf creams that's available from somebody gives you from any of these parlors or anything, right? Now another question: which laser treatment is good for skin whitening? So as I mentioned before, be careful using laser in type 4, type 5 skin. It can cause hyperpigmentation too, but yes, lasers can be used. Predominantly the skin lightening laser is either the Nd:YAG, used in a technology called either quick Q switch or pico. So it's the wave, the duration in which that laser is applied changes between these technologies. So Q switch laser or a pico laser is what is generally used, or an IPL laser, but IPL is preferable for lighter skin. So for darker skin, preferably either a Q switch or a pico laser is what is used generally in all this for laser lightening or laser toning. Is what laser facial they are all called in different names, but the base of all of this is either Nd:YAG laser used usually Q switch or the pico lasers, right? So that can be used for skin whitening, but don't and even carbon dioxide also we do laser peel very superficially. It's not going to get, it's done just like, it's mainly when you do it very superficially, it's not more in terms of exfoliation, but not to lighten your melanocyte, which is in the deeper layer. So if you want to reduce the melanocyte activity, I told you it has to go to the base layer of your skin. So keep that in mind. Then someone wants to know, is cosmetic peeling effective for men? Of course, yes. The skin is the same. whether it's men or women. So there's someone, that crazy cookie. Hi, good evening. So you want to know what are the treatment for lightening your knees. So the pigment lightening principle by and large is the same. So your knees may become darkened, maybe because it's of friction melanosis, we call it. If you have the habit of doing exercise with continuous kneeling down and your skin is dry, it can cause hyperactivity of the melanocytes. Or it could be you had some injury there or some aberration there which stimulated some inflammation, and that caused hyperactivity and pigmentation. Whatever be it, the principle is the same. You have to exfoliate the layers of cells which are loaded with melanosomes, and you have to reduce the activity of melanocytes. That's the basic principle. Remember these two. How do we exfoliate? You can use scrubs, you can use creams, you can use mild peels or whatever. How do you reduce melanocyte activity? Yes, not all creams can penetrate to the deeper layer. You may need procedures like microneedling or fractional RF or whatever, which can create these channels, then apply these serums to go deeper inside and controls the melanocyte activity. Only then will it work. Of course, we have, I told you, control depth peel that can also help you to gradually lighten. But remember, after doing all of this, you're layer by layer, you're removing the plaque melanocytes, you're reducing activity, and then you go back and start doing whatever that initially induced melanocyte, it will recur again. So keep that in mind. Many of the patients ask me, so I have done 4 sessions, 6 sessions. Are these results permanent? Please understand, the melanocytes are there in your skin, acne, sebaceous glands are there in your skin. Excuse me. None of the physicians are doing anything to remove these melanocytes or remove the sebaceous glands, right? We are all working on reducing their activity. And once we reduced, we give you some protocols to follow. If you don't follow these protocols and whatever the triggering factor is going to continue or going to recur, though whatever the symptom you presented initially with will come back again. So keep that in mind. So following up regularly is very, very important in that regard, right? So benefits of chemical peel. Is chemical peel safe for the skin? I've already explained. Don't do too many peels continuously. You will make your skin thin and it can cause aging faster, wrinkling faster. Yes, it has good benefits. That is chemical peels. So there is a chemical which is used for exfoliation. What is the chemical used determines what is the end results. There are chemicals used to lighten. There are chemicals used to reduce sebaceous glands. There are chemicals used to resurface. Ingredients are different. And you when you use these peels regularly, but you don't rebuild your skin, it's going to have an impact on your skin. The skin becomes thin. You can see the veins underneath, also when you go on sunlight, you can have extreme redness, so on and so forth. So be careful when you take these chemical peel, right? Vampire facial. Okay, so what is vampire facial? So vampire facial is use of PRP, platelet rich plasma. So platelet rich, our blood has 3 types of cells. So there is a liquid part and a solid part or the cellular part in the blood. So the liquid part is the plasma, and the cell part is you have white cells, red bloods, and platelets. When you have an injury, there's a cut injury, the blood bleeds for some time and it clots. So the clotting is done by the cell called platelets. And this particular platelet is a storehouse of all the growth factors that repairs damaged tissue. So what is PRP? It's platelet rich plasma. So you take these platelets, plasma rich in platelets, we take your blood, we concentrate, we send them. Now, there are many of patients tell me, I did PRP, either for the hair or for the skin, 6 sessions, 10 sessions, 15 sessions, but it didn't work. Why it didn't work is if the solution that is being used as PRP on your skin or hair If it does not contain 3 to 5 times your baseline platelet amount, it is just taking blood from one side and putting it on the other. It is nothing else. So unless the plasma is rich in platelets, it's not going to give you the result that you are expecting. So it's important to know what systems used in clinic, whether they are concentrating. So at Tamira, what we do is every month or so, we try and take one patient's sample, we send it to the lab and check if the machine is working properly for the calibration to get that PRP. Now with the PRP, so you have PRP on one side, and how that PRP is delivered. Now vampire facial, or it's everything about it. So you use a micro needling or a needling technology, and you use this PRP, and so that drives the rich plasma into your skin. So that platelets released, the platelets are activated, and the growth factors rich plasma is infiltrated deep down into your skin, and that is supposed to rejuvenate, restore damages in the skin. That is called vampire facial. So this is very clear, right? Whether it's done for hair or for skin, it is what. So it's very, very important how this PRP is prepared and how is it delivered will determine whether you get a good result or not. And also, it's not that if you put this without treating the underlying cause, for everyone you'll get the same result. No, you won't get the same result. So it's important to understand why it is done, whether you have any underlying problem, correct the underlying problem, then treat this. So I think we're almost end of this session. So before I close, thank you very much for being with me. Thank you all for joining, and I'll see you all on our next episode of Self-Love Recipes. Good evening.